to switch gears and talk about nonsteroidal anti-inflammatory gut drugs in the gut microbiome. In this depiction, you can see the human and the interplay between the altered environment and enteropathic recycling of NSAID on the effect of altered enzymes and the gut microbiome. NSAID-induced dysbiosis is mechanically and mechanistically linked to gastrointestinal injury and particularly NSAID-induced enteropathy. The pathogenesis involves disruption of the mucosal barrier, increased translocation of bacterial, and the specific products including lipopolysaccharide and activation of pro-inflammatory pathways. NSAIDs and opioids, but I'm going to focus on NSAIDs, change intestinal motility and the luminal pH and bile acid metabolism. Direct drug-induced inhibitory effects on bacterial growth are at hand, and this leads to mucosal inflammation, all directly impacting composition and function of the gut microbiota. Indirectly, this alters physiologic properties or functions of the host, the human, which may in turn precipitate a dysbiosis of the gut. In this image, we can see that the microbiota signatures associated with the use of NSAIDs and opioids and with certain diseases in which these medications are used, leading to gut dysbiosis. Again, the mechanisms at hand include mucosal inflammation, changes in motility and bile acids release, and the inhibition of peristalsis, which may be one of the major factors that leads to gut dysbiosis directly affecting opioid treatment. Because NSAIDs and opioids can promote the growth of certain gut bacteria linked to disease, it's possible, theoretically speaking, that using this medications long-term might actually help keep those conditions going rather than resolving them. So it's a complex picture, and you've got many things at hand here impacting gut dysbiosis. It's even plausible that microbiota-driven joint inflammation and metabolic alterations in certain patients with arthritis or diabetic neuropathic pain may decrease the therapeutic efficacy of NSAIDs and opioids. In this case, restoring the balance in the microbiota composition would be expected to improve the effect of these drugs on disease activity and well-being of patients. And this tries to get to the root cause of not just treating the symptoms of arthritis, but trying to look at the gut-brain axis and what's going on with the signaling and neurotransmission. In this example, we can see that there's a lot of pharmacokinetic and pharmacodynamic processes at hand. Drugs can have a direct antibacterial effects on intestinal microbiota, and we talked about this with the SSRIs, and it can also indirectly alter the environment for microbial growth by their pharmacodynamic effects on the host. And in this example, it's going to be the proton pump inhibitors and NSAIDs. We know that the PPIs alter gastric acid production and pH, and NSAIDs change mucosal integrity. This is illustrated through the processes that we've talked about today in the microbiota drug interactions. You get the bioaccumulation of bacteria-accumulated drugs without biotransformation that can also occur. The interactions between the host and intestinal microbiota cause the enteropathic recirculation of drugs. And so we don't always think of this as a point of how the drug's handled. There's many scientific papers and evidence to prove this. In the enteropathic recirculation of drugs, the intestinal microbiota are at hand. So overall, we have a balance to achieve in trying to look at strategies to reduce microbiome damage. In this balance that we've talked about today, there's the role of antibiotics that we need to be very careful with and not be treating viruses with antibacterials in the first 3 years of life, being judicious with antibiotics because that's going to be the critical phase that we discussed of developing and populating the gut microbiome, trying to reduce drug microbiome interactions. Patients are on certain drugs to try to dig a little deeper and look at the interactions and when appropriate, what are the things we can do to restore the microbiome community. We know fiber supplementation is going to be important, using probiotics and the right ones when appropriate. And then in the worst case scenario, patient develops C. difficile, fecal microbiota transplantation has been successful.